pronunciation po, Santiaguel, tama po?
Santiaguel.
Okay. So, isang pagpalaya at makakalikasang hapon po sa ating lahat. And welcome once again to What Matters, a feature live talk show here in Miss Philippines Earth, featuring your Miss Philippines Earth 2020 with a featured guest speaker. In this series of mini talk shows, we are going to be discussing about the different topics that we feel as queens should be discussed, especially by our countrymen, considering the fact that we have been experiencing a lot of different phenomena, not just in terms of our environment, but also in terms of our health. So, of course, before anything else, this is Patricia Santos, your Miss Philippines Air 2020, together with my sister queen, Miss Philippines Water, Gianna Llanes. Hi, Gianna!
Hi! Isang makakalikasang araw po sa inyong lahat. Hoping everybody is doing good. This Freedom Friday, it is Friday, so I hope everybody's just in good spirits right now.
Yeah, and we're supposed to be joined by Miss Philippines Earth 2020, Roxy Games, but unfortunately, I think she has been experiencing a couple of technical difficulties since she has just arrived in Baguio. I think yesterday lang. And right now, nawala siya. So I think it's attributed to our internet connection. So maybe she'll join us later. But otherwise, you have your water queen and your air queen to accompany you this afternoon to talk about what matters. So Jenna, for you, what matters?
Well, I've been very vocal about this and I've taken a lot of action with it as well. But what really matters to me is bringing a light to the marginalized sector. So I have started my initiative called Bukhaw, where we distribute relief goods to marginalized communities who are struggling right now. And I also, in the past few months, worked with Protect the Frontline to deliver meals to frontliners in various hospitals across Metro Manila. So a message that I've always wanted to portray is no matter how little you think you have, you can always give back. You can always provide that help. So I think that's what matters most to me, especially because I look up to my Lola so much, and she was actually the vice governor of Pampanga for 2 terms. So I really saw her just reaching out to the marginalized sector, giving everything that she had. And I think that also represents what matters most to me.
Yes, I have to agree with that. Really matters, right? What really matters right now is, human beings relying on each other. And how about, I saw her kanina. Yes, she's right there. Roxy, our Miss Philippines Earth 2020. Are you there? Or wala ulit? Well, what matters? So for me, aside from internet connection right now, I think what really matters is, constantly challenging each other to be better. And we have to constantly ask ourselves, what can we do better in our lives? What can we do to become better caretakers of this planet? And what can we do to become better citizens? And this afternoon, we will be asking ourselves through the guidance, or let's say through the perspective of somebody who has, I think, mastery over the subject. This afternoon, we will be asking ourselves about what really matters in a pandemic, ravaged world. What really matters, especially when it comes to our health. And in order to guide us about this topic, we have a very special guest this afternoon. And I'm sure that we guys will be learning a lot from him, especially for our topic. And let me start by introducing our very special guest. Yeah. He is a graduate of the UP College of Medicine Intermed program, and completed internal medicine residency and pulmonary fellowship at the UP PGH Medical Center. He also completed his master's degree in occupational medicine at the UP College of Public Health. He's also a fellow of the Philippine College of Physicians, Philippine College of Chest Physicians. He is also an associate professor in the UP College of Medicine and a training officer in the Department of Medicine, Quirino Memorial Medical Center. And he's also the team captain for COVID wards and ICU Philippine General Hospital since March 2020. Everyone, let's give a virtual round of applause to our guest this afternoon, Dr. Joel Santiago. Hello, Doc. Good afternoon po, and thank you very much for joining us this afternoon.
Hi, good afternoon, and greetings to all the beauty queens and, of course, all the participants through the web. For this afternoon, we'll be discussing COVID-19. As you very well know, this is a very important topic now, and it is essential that we become familiar with not only being aware of what's happening, but also be aware of how we can prevent or avoid getting or developing this disease. So I tweaked the discussion a little because I would want you to be familiar with how we can avoid or prevent this disease. So I have some slides, so probably if I can share. Okay. So this would just be a brief presentation or discussion of what would be important or how we can prevent or avoid getting COVID-19. So right now we have a lot of infections locally, but we would also want you to understand that it's not just here locally, but worldwide that this is happening. So just to show you that this is the virus. So it came out roughly late December last year, and it's a coronavirus. It's more or less related to the common cold virus, so pretty much the same. But since this is a new virus, we don't have protection or we don't have immunity against it. So that's why a lot of people are getting sick and some are dying, unfortunately. And if we look at the current rates or prevalence of this disease, you would see that worldwide right now there's more than 22 million worldwide. And with that, there's more than 700,000 or almost 800,000 deaths. And if you look at the list of countries affected, you would see that US, Brazil, India, they have a lot of infections. And we are actually still fortunate that it's not that much that we have. We have more than 2,000 deaths, unfortunately, with more than 170,000 infections. But if you compare that with other countries, we're still relatively smaller. There's not that much infections going on, and we should keep it that way. We should avoid getting into the top 10 in terms of numbers of infected individuals. So as much as possible, that's what we're trying to do, and that's why I would want to discuss prevention or avoiding infections for this afternoon. Now, this is how you get the infection. Mostly, you can acquire it through infected droplets, but there have been evidence that it may also be through micro droplets or even aerosols. So that's why it is very important that people should be wearing masks and that there should be distance between people so that they would not uh, get the viral particles. You should know that these viruses, they're actually not alive, they're inanimate. But once it gets into you, it gets into your cells, then it can replicate and develop and can you can pass it on to other people. So that's the main way that it goes around. Now, in terms of symptoms, mostly it is dry cough. Later, you can develop shortness of breath. Then, of course, there's some fever. There may be chills, there may be sore throat, loss of taste and smell, muscle pains, headache, diarrhea. So pretty much what you experience if you get or acquire the common cold or influenza. So trangkaso or influenza, this sums up pretty much what you may also experience with the COVID-19 infection. Now, this has been reported a lot. There's initially loss of smell or loss of taste before you develop the fever and the cough. So you should be aware of that, especially if you got exposed to someone with COVID-19. And actually, there are also reports that there are skin manifestations or dermatologic manifestation, neurologic manifestations. There's a lot of possible effects of the virus on people. Now, this just shows you uh, the difference between COVID-19, common cold, flu, allergies, and actually a lot of times it may not be easy to differentiate one from the other. So you would need to look at exposure, you would need to look at travel history, and of course, especially now that we have a lot of infection, anything that develops, no, may fever, may cough, then you would have to suspect that it might be COVID-19 and be tested for it. And now, this just highlights the risks or its potential. So it may be a simple cold or flu lang, trangkaso, but in some people, especially the elderly, those with other conditions, they would and they can get hospitalized, and some of them can die in as little as 10 to 14 days. But for most people, in 14 days more or less, you would already be cleared and you would already be nearly back to normal. So that's more or less what's happening. So this is not really that accurate now. Right now, what we have is roughly around 90% would be mild cases, and roughly 7 or 8% would be asymptomatic. So you didn't even know that you had acquired the infection. Then 1 to 2% would be the critical and severe illness. So those who need hospitalization, those who would need ICU admission, those are more or less the statistics that we have now. Now, just to mention, remember, if someone is older, more than 60 years old, this would be the chances or the likelihood that they may die of the infection. So especially if someone is more than 80 years old, there's a high chance that they might die if they get infected. So we should be very careful. Other than that, those people with high blood, diabetes, heart disease, post-stroke patients, patients with asthma or COPD, and definitely patients with cancer would be at higher risk compared to other people. And again, this just shows you that risk with those patients with cancer. Now, prevention will focus on this. So definitely basic cough etiquette, basic things to prevent infection like washing your hand frequently, using alcohol, avoid touching your eyes, nose, and mouth, social distancing. These would be the simplest things that should be done. Now, I got this and I would like to acknowledge DTI, the Department of Trade and Industry, because they released the guidelines for the prevention of workplace infection. And these are quite important, which we should also look at. So, for one, use of masks. Right now, as much as possible, you should always be wearing masks, especially if you're outside the home. If at home or if you're alone, you can stop wearing the mask. But if you're with someone else, you should always wear a mask. Now, you don't need to wear an N95 mask or the specialty mask, especially if there's no significant or high risk of getting exposed to someone with COVID, and you should try to limit using or buying it because we're using it in the hospitals for confirmed cases. So just a simple face mask, face cover would do. Now, those masks with vents as much as possible. this is not recommended because the vents actually, if you are the one having who already has COVID, these vents can actually further lead to you exposing or causing infection in others. So it's not recommended. But the basic surgical or cloth mask should be worn by all right now. Face shields also is currently recommended. So I would show you later the additive benefit of using the mask plus the face shield and of course the social distancing. So there are specifications for the recommended face shield, so it should always also be worn. Now the physical distancing we've been pushing for its use since March or even before that. Now, this is the main way that you can avoid getting contaminated with the droplets. Now, this just highlights the combination of these maneuvers. So the mask plus the face shield, there you can prevent getting exposed and getting infected by 93%. But if you add on that social distancing, you would more or less prevent infection in up to 99% of the time. But of course, you should also combine this with frequent disinfection. So especially if you touch any surface or touch anything that might be infected, then you should use alcohol or you should wash your hands and definitely don't touch your face. And of course, even the mask, the face shields, there should be a proper technique of you removing it after using it because it can potentially be infected. You touch it, the virus might be on your hands, and if you touch your face, then or your eyes, then you can get infected. Now, these are some other things that might lead to infection. So, the use of vans, even cars or shuttle services. So, it is important, for example, in workplaces or you're going together, then you should not or limit talking. You should limit uh, eating, taking phone calls. You should not take off your mask even if you're familiar with each other because that has been shown to be one way of getting infected together in cars, together in buses or shuttles. A lot of times, not only in PGH but in other companies or industrial sites, this has been one route that people are getting infected. There should also be adequate ventilation. So if it's possible not to have the air conditioning on, that the window should be a little bit open so that air can circulate from outside that can minimize the accumulation of viral particles if one of the passengers is actually infected. And of course, dining or eating, this has also been recommended that as much as possible, you should not eat together. There should be distance between people eating. That there should be barriers. People should not be talking while eating because again, this has been shown to be a reason why people are getting infected. So we, for example, those who are directly looking at treating, managing patients with COVID, we have a low rate of infection because we're aware that there is that risk and we know the risk. But actually, what's happening is those people who didn't know that someone with them is infected, they are the ones who also get infected. And from there, they can pass it on to their family members, their households. So that's the problem most of the time. So we should always remember that. Meal times, as much as possible, should be staggered. So that's one recommendation. And this just highlights that the issue with eating, and this came from PGH. So when you eat, you lower your mask. When you eat, you talk, you can generate aerosols which can carry the virus. And then sitting together, so there's prolonged exposure to one another, and that this time the distance frequently is not more than 1 meter. So that's one big risk factor. So I think more or less, that's it. Just briefly highlighting things or tips that we can do to prevent or avoid getting infected with COVID-19. Now, with the other aspects or other things that we would want raised or discussed, I think we would have still sufficient time to for your questions or queries. Okay,
Yeah.
thank you.
Thank you very much po, Doc Joel, for that very informative talk. I'm sure all our viewers right now, everybody had, an eye opener. They learned a lot of different information and tips that will help them, do what they can to reduce the transmission of this virus, because currently it seems like the transmission is still uh,
Um,
not be not being controlled very well by current health protocols. And on that note, I think the first question that I would like to ask is, why do you think that our cases is still going up? Why is the curve not really, getting beaten, despite all the different protocols, all the different lockdowns that we have been doing? Why do you think, what is the problem, and what do you think really is the best solution for that? And what would be the role that each and every Filipino should play in this?
Well, there are a lot of factors which could be the reason for that. It's not just simple discipline that people are still going out despite the restrictions. It's not just that simple. People not wearing the mask, not wearing it properly, not using the face shield, not physically distancing themselves. So these are just simple things that we should consider. But beyond that, would be, of course, the lack of testing. So and even the results. So a lot of times you get tested. It would take 5 to 7 days before you get the results. So some people, unfortunately, already would have died before they even knew that they had the infection. So that would put all the other people around them at risk. And then, of course, there's contact tracing. So there are a lot of limitations when it comes to contact tracing. So there are a lot of reasons why we have that. Now, the main target is for us to be able to cope with it, or like for the hospitals, that we do not get overwhelmed, because March, April, when we had the ECQ, it was a strict quarantine. There was strict control of movement of people. We were still okay. Well, there's a manageable number of patients in the ICU in the wards who had COVID. But after opening up, when we got into GCQ, then 2 weeks after that, we are actually right now overwhelmed. Like PGH, more than 200 persons or 200 individuals with COVID, and a lot of them are critical. So the main target of what we're doing is for the hospitals, the healthcare system, not to be overwhelmed. So yun naman yung goal. While waiting for vaccine to be developed, while waiting for proper treatments to be developed. So unfortunately, this is a pandemic. We can't really avoid, and we can't expect that mawawala na lang yung infection or the virus unfortunately. So people or everyone should help each other and should listen to the government, listen to what is recommended or advised, so that we can at least slow down the infection and avoid getting too many people with infection.
Dr.
Uh,
Joel, I like how you acknowledge that yun nga, we still have a lack of testing and a lack of resources. And as a member, of course, of the general public, that's something quite comforting to hear that we're acknowledging the situation. I actually have a question here from Miss Philippines Earth, Roxy Bayans herself. She said, is collective efforts like abiding by the rules and working in solidarity as a community enough to flatten the curve of the COVID-19 pandemic? And how cooperative do you think is the general public about all of the rules?
Mhm. Well, that would be a start. Discipline definitely would play a big role. But and complying with the recommendations would be a start, but it should not just be the people, the government, of course, improving healthcare, expanding testing capacity, expanding and increasing the number of beds available, availability of ventilators. So there's a lot of things that should be done, and it should not just be the people. Of course, the people, probably what you were mentioning was the use of mask, and from a survey, Filipinos were quite compliant with mask wearing. But of course, as you just say that 90% are compliant with mask wearing, but you look at it the other way, so there would be another 10% who are not regularly wearing the mask, and these people are the ones who unfortunately would be at higher risk and who can easily bring it or give it to other individuals.
And earlier, if I can ask another question, I was saying that one of my, I guess my passions or my focuses is really helping out the marginalized sector. Currently, a lot of them feel like they don't have the resources to get tested, or if they do test, they're scared to get tested because if they test positive, they might not have all of the financial help in order for all of the medications. So for the members of the marginalized sector right now who feel the symptoms, what do you think would be the first step that they should do to ensure that they're going to help themselves?
Well, first thing that they should do, for example, they have that sore throat, they have fever, they have cough, and they suspect that they might have the COVID-19 infection, would be to isolate themselves. So, if it's possible for them to get isolated in a separate room with no other persons going there, then that would be the best. However, with marginalized individuals, unfortunately, that might not be possible. So the next thing, especially if the symptoms persist and they already have shortness of breath, would be to go to the hospital. Now, we have a lot of government hospitals who would not refuse patients. Of course, unfortunately, with private hospitals, the cost would be very expensive. It can range from 1 to 4 or 5 million if you get hospitalized in the ICU. So we have government hospitals. We have like I work in PGH, I work in Quirino Memorial Medical Center. So these hospitals would not refuse you as long as they have vacant beds. So, and then we have the one command center which they can call and which can coordinate and look for the hospital which can assist you. So, don't wait before you have the shortness of breath or being severely ill before going to the hospital. You should go as soon as possible.
So before we proceed, guys, everybody who has just caught up with us right now, you guys can also ask questions. You can comment down below if you have something that you want to ask our expert, Dr. Joel, pulmonologist from PGH. And our topic for this afternoon is the health status of the Philippines amidst COVID-19. So drop your questions. We will be willing to let our expert answer them. And also, speaking of questions, even though she wasn't able to join us this afternoon due to an emergency, our Miss Philippines Ecotourism 2020, Elisa, also sent us some questions she wanted to personally ask you, Sana Doc. One question is, she doesn't know a lot about the Philippines healthcare system. So what would you say would be the key differences between the health system in the Philippines and the health system in Australia when it comes to the differences in health outcomes? How do you believe can it be made better, or a healthcare that is more people-centered?
Okay, so I'm not that familiar with Australia, but I would assume that this would be similar to the British system, and
Yes.
these are quite different from the American system that we have. So helping them. Definitely funds for healthcare facilities would be one. Expanding the available hospitals, the available hospital beds, the available ventilators, and of course, the healthcare workers. So, in some hospitals, we have the beds, we have the facilities, but we don't have the physicians, the nurses, the other essential workers. Some of them also get sick. So unfortunately, that's the problem. So and it would not be solved by this pandemic. Well, actually, this pandemic is facilitating improvements. We now have more ventilators, for example. We have more funds, which happened because this pandemic happened. But overall or long-term goal would be expansion of facilities, infusing more funds for healthcare in all hospitals. Now, uh, it's quite different. Well, we have our own Medicare, the PhilHealth, which theoretically should answer, and the universal healthcare, which theoretically should answer for everything, but unfortunately, it has a lot of limitations. In Australia, in the US, either it's insurance or the government themselves, which would pay for the management or treatment. So there's a lot of differences, unfortunately.
So
Yeah.
there's a
And
really go ahead.
yeah, okay, go ahead. Please go ahead, Mel.
Okay. There's a really interesting question right now on the live. This is from Michelle. So we experienced the MECQ for a couple of weeks. From a doctor's perspective, do you think it was actually effective?
Yes, MECQ would be effective, but unfortunately, what's happening is once you stop it, you go back to GCQ, wait 10, 14 days, then you would expect again a resurgence of cases. So that's what happens because once you relax the isolation and quarantine, people would go out, then they would forget to self distance or do physical distancing. They forget to properly wear their mask. That's the trend that we're seeing from ECQ before, then we went into MECQ, then GCQ. So progressively, there was an increase in cases. Now we went back to MECQ, so it became tighter. We again saw a decline in the number of cases after 10 to 14 days. Now we're relaxing again, and unfortunately, we would be expecting a resurgence of cases in 10 to 14 days. Now, I would also agree that unfortunately it's a big problem. We people no longer have work; they don't have money, so you have to balance health and economy. So right now there are a lot of lobbying coming from businessmen, and they're pushing for the economy. Unfortunately, but it's true that we can't stay locked up forever. So we'll have to live with it, unfortunately.
Yeah, I think that is the biggest challenge right now, balancing all the different interests of people, may it be for health, for the environment, or for our economic status, even as individuals. But another question from Elisa, all the way from Australia, is actually related to the news about the vaccines. Lately, there has been news in Australia that many countries are coming really far in making a vaccine for COVID-19. And countries like Russia has made one and are currently in testing trials. Is the Philippines also trying to do their part in creating a vaccine or in ensuring that everyone is safe and decreasing the number of positive cases are more of the main focus at the moment?
Yes, decreasing the number of cases, that's our main goal. We're trying to flatten the curve so that the healthcare facilities won't get overwhelmed. Now, in terms of vaccine development locally, unfortunately, I don't think we have our own vaccine development program. Most of the time, we just rely on vaccines developed abroad. We purchase them and then bring them here. Now, there are a lot of vaccines being developed, and at the forefront would be those being created in China and then in the US, in the UK, and Russia. Now, hopefully, what they're targeting that it should be released or should be available by October or late this year. But looking at the vaccine development, it's not that easy. Currently, they're in phase three trials, so they're testing it in some patients, but that should later be expanded before you can release it for public use. So most of the time with vaccines, actually at the minimum that would be at least 1.5 to 2 years. But we're hoping that later this year, if they can fast track its development, then hopefully by early next year, the vaccine would already be available. Now, the availability of a vaccine is one question. The other question would be the sustainability of the protection. So what we're seeing now with current infections, you get infected, but and you develop the antibodies for it, but unfortunately, the protection might not be long lasting. We're seeing that after several months, 3 months at most of the time, you already no longer have the protection, and even shorter than that. So some people get reinfected. They develop it, they're okay, they go out again, they can get reinfected. So that's one issue. So we're still not sure. So there's a lot of uncertainty with this virus. That's a big problem that we have now.
Well, another question actually really from Elisa is she also mentioned about the Fabunan antiviral treatment or injections. And this was for a while in the news as one of the possible solutions or cures when it came to this coronavirus pandemic, as well as the recent drug from China. There was a recent medicine that is being currently marketed as uh, a possible medicine that will cure coronavirus. And what are your thoughts on these two?
Okay. First, the Chinese drug Linwaquan, I think is the name. Uh, it was approved by the FDA as a traditional Chinese medicine. So it is not and should not be used as a treatment for COVID-19. So again, we don't have and all the things that we're giving now is investigational or experimental. There's no proven cure yet. There's still a lot of limitations in terms of study. So but there have been things that are working, and there are a lot of medications given before that doesn't work. Now, Linwaquan or the Chinese medicine is a traditional Chinese medicine. Supposedly, it can shorten the duration of the infection, but again, we don't have big studies with using it. And for you to have strong evidence, it should be randomized, controlled studies in a lot of people, and it should be replicated. So, with regards to the Fabunan medication, actually, I think the FDA would be open to it being registered. So that would be the first thing that should be done. It should be registered with the government regulatory office, that it should undergo testing, that research on it should be done. So if the research shows benefit, then it can be used, but not with just one or two persons then saying that they're okay and they improve with it. So if, the science and research doesn't happen that way. So it's not just testimonial evidence. It should be randomized controlled trials that are done for these medications before it gets registered and can be used.
Doc Joel, I actually have a question from Miss Philippines Earthfire, Shane Tormes. She said, if a vaccine is created for COVID-19 here in the Philippines, will the government or other countries make it mandatory for citizens and residents to be vaccinated?
Yeah, it should because everyone is at risk. And you very well know that. And you can see that the more than 22 million people worldwide have had it. And we have roughly 7 billion people worldwide. So there are a lot of people who can still get infected. infected, and a lot of them can still die if we don't protect them. So if the vaccine becomes available, definitely it should be given for everyone and as much as possible given for free.
Okay, I think
Okay. So
there's
yeah,
a
I have a
question
question
here.
right there.
Oh yeah, sorry. I thought your internet connection broke. But there's a question here from Alfred Tapel on the live. He said, Doc Joel, what is your side on our COVID battle here in the Philippines? Do you think that we are winning the battle?
Well, truthfully, right now we have not flattened the curve of infections. Actually, right now we're in a plateau. Actually, it's even rising, and it's rising quite quickly. Before May, June, where we were in a plateau, we had not flattened it or reduced the numbers. But since we released the people into the communities, people went to their provinces. That was when we saw that big spike in the cases. So unfortunately, that would have been expected that once you let people go to other provinces, other cities, other communities, then they can bring the infection with them. So I would say that we still have not fully controlled it actually, and it would still take time, and that eventually we would need to live with it. So slow it down so that the uh, healthcare facilities are not overwhelmed, and that hopefully we get the vaccine soon so that we everyone can get protected.
Well, Doc Joel, another important question I believe is something about its connection with our brothers and sisters living with HIV, because I recently heard from a lot of them that there is a rumored decrease in the supply of the antiretrovirals. In fact, they are saying that a lot of the different factories producing it in India are having a hard time meeting the demand. And there is a rumor that there might come a time where they won't be able to give the ration supply to each person living with HIV, especially here in the Philippines. What do you think should our brothers and sisters living with HIV, should they be worried? What should they be doing at this time? Are there contingency plans currently going on with our government regarding this issue?
Yeah. Actually, it's not really a rumor, but remember that most of the funding that we're getting for the medications for HIV and AIDS is coming from the Global Fund, so
Yeah.
the Gates Foundation, and I think that they had decreased, and there would be a time that they would no longer be funding our medications or our supplies, and I think it was supposed to be cut last year, but I'm not sure if it had gotten extended. So the reason why they're getting their medications for free is because of that global fund. It's not only for HIV and AIDS, but also for tuberculosis, for example. Now, currently, we still have the medications available. But it's true that because of the pandemic, there have been the disruptions in the global supply chain. So no planes coming in, cargo have difficulty, and then the production facilities have limitations because people get infected also there. So those are some things that can disrupt the supply chain. Probably they should coordinate closely with their facilities or their hubs, because their hubs would have and could have the answer for that. Now, later, hopefully, our local manufacturing facilities, our pharmaceutical companies locally here should produce these medications for the use of our local PLHIV patients.
Yeah, okay. Thank you very much, Doc. I'm sure that our brothers and sisters who are living with HIV, who have family who are living with HIV, feel a little bit associated with this information from you, sir. And I think we're almost done. It's 5:48 time check. And so our last question. Do you have any more questions, Ja?
Oh, I actually have a question, and I think that yeah, this relates to my advocacy, and this one is also from Miss Philippines Earth 2020, Roxy Bayens. She says, other than taking the precautions, in what ways can we, the general public, further extend our help and support to the frontliners?
To the frontliners, uh, well, discipline definitely would be the first thing. So follow the rules, follow the recommendations, follow the advice. If it's not necessary for you to go out of the of your home, then try not to do that, because you're a warm body and you can technically and potentially get exposed, get infected, then you can bring it to your home. So we don't want more people getting infected. As simple as that. Other than that, the donations, of course, but unfortunately, we have seen donor fatigue. Before we get food, we get supplies, but over time, people probably have also burned out their resources. So, but just being disciplined, I would say, would be the best thing for people to assist or help the frontliners.
Yes, thank you very much, Doc. And our last question for this afternoon is going to be related to the environment, and of course, also related to my advocacy. My advocacy is part of it is encouraging people to ban single-use plastics, but with everything that has been happening in not just in the country but also in the world, we have observed a steady rise in the use of medical disposables. And so, what do you think? What do you think should be a perfect solution in order to prevent, the adverse effects on the environment, considering that it is also unavoidable at the moment to be using these medical disposables?
Yes, that's true. That's a big issue or problem that we are seeing and we would expect, because the more patients that you have, the more severe the disease that they have, the more resources that you are using. So more plastic is being used for the medications, for their intravenous lines, for their treatments, for their nutrition. So it carries with it a big problem of plastic waste. Then you have the gloves, you have the face shields, you have the goggles. So some of them can be recycled or can still be reused, like the goggles, but a lot of these things like the gloves, the face shields, unfortunately are not recyclable and are potentially infectious. So it's a big issue. Right now, we still are able to cope with it. So there are waste management teams and waste management programs for each hospital. But long term, I think, and I would suppose that the government should also act and consider programs for that, because it would be a large scale problem that we should look into later.
Okay, so thank you very much, Doc Joel, for joining us this afternoon. And of course, thank you very much to everybody else who watched, gave their own input through the comment section. Your comments, your questions are all dearly appreciated. And we are hoping that you won't forget to watch us next week. But of course, don't forget to like and follow the official Miss Philippines Earth page here on Facebook or on Instagram, as well as our YouTube accounts. Of course, don't forget to follow me at Patricia Santos X. That's Instagram, and also on Facebook, Patricia Santos. And of course, your social media account, Jana?
Yeah, my social media is at Gianna Llanes on all the social media platforms. I have a radio show tonight, so if you want to catch it, it's on Wave 89.1. I'm going to be on in a few minutes, so I hope you can join me there. Yeah, check out the Miss Earth Instagram and Twitter as well. That's at Miss Earth. There's so many things happening. There's going to be a one-day getting to know you event of Miss Earth 2020 delegates Amidst, which is going to happen on the 21st of September. And of course, with that, we will continue to support our own representative, Roxy Bayans, who's representing the Philippines for Miss Earth. And starting September 22, there will be daily pre-pageant events. So our international delegates will showcase their talents and elegant costumes. So just stay tuned for that.
Yep, and to know more about the time and the different delegates assigned, please just visit the official Facebook page of Miss Earth and make sure that you just get to watch out for all the different activities for the first international virtual pageant. That's Miss Earth 2020. And so, thank you very much, everybody, for joining us this afternoon once again, and see you in our next episode, which will be next week on August 24 at 5 to 6 p.m.
Bye,
Thank
everyone.
you so much.
Thank you,
Bye.
Dr.
Thank you
Joel.
so much.
Bye.